All right, thank you all for joining us today for our first South Talk of the fall semester. My name is Afton Thomas, Associate Director for Programs with the Center for the Study of Southern Culture. I am going to assume, and let's face it, I am really hoping during this time of virtual events that people are joining us from all over the country. And with that assumption, you may not know what the Center for the Study of Southern Culture is or where it is located. We are located in Oxford, Mississippi, on the campus of the University of Mississippi. And I will put in the chat a link to our website so that you can learn more about us, including what we have coming up this fall, okay? We are excited to welcome our panelists today for the discussion that they have titled, Our Body Tells a Story, A Pathway to Resilience and Wholeness. Before I introduce our panelists, I thought I would share how this collaboration came to be. Staff from the Delta Population Health Institute reached out to Center Director Katie McKee earlier this spring, pre-pandemic, and wanted to share a bit about their work and see if there was a way for us to partner in some way. We said yes and invited them to give a talk as a part of our fall SouthTalks. When we came together again in June, we had more clarity on the topic. Doctors Brookshield Laurent and Jennifer Conner have been on the ground in Arkansas working with the communities on testing and education concerning COVID-19. Jennifer Conner is an associate professor and doctor of public health. She was instrumental in launching the Arkansas Coalition for Obesity Prevention and has achieved many policy, system, and environment changes along the southern U.S. region to improve community resiliency. In 2019, Conner was named a Robert Wood Johnson Foundation Culture of Health Leader finalist and led her hometown of Lake Village, Arkansas, in being named a RWJF Culture of Health Community Prize finalist. Dr. Brookshield Laurent is the founding chairwoman for the Department of Clinical Medicine at the New York Institute of Technology at Arkansas State University and the founding executive director for the Delta Population Health Institute. Doctors Laurent and Conner are joined today by University of Mississippi professors and co-directors of the Center for Wellbeing and Creative Achievement. In short, we call it CREW. Dr. Cafer is an assistant professor of sociology, and her research focuses on improving community-level resilience by integrating food and healthcare systems for better. Meagen Rosenthal is an associate professor of pharmacy administration, and her research focuses on developing systems to integrate health research evidence into practice faster and more effectively. Okay, so it made sense to pair DPHI and invite CREW to be a part of the discussion today. The center, we pride ourselves in being collaborative in nature, and we are very excited for today's discussion. Together, all four, Doctors Laurent, Conner, Cafer, and Rosenthal have collaborated with the center in yet another way. They are currently working on a roundtable conversation that will be published in the center's online journal, Study the South. In their roundtable conversation, they will discuss how COVID-19 has highlighted how racial and ethnic minorities are disproportionately impacted by health disparities in the rural South. Okay. So you can look for that later this month. If you do not currently receive the center's Study the South, I will also drop that in the chat, how you can sign up for to subscribe to that online publication. Okay. Please help me welcome from your homes, from your offices, our panel today. Thank you.
Thank you, Afton, for that really lovely introduction, and letting our audience know who each of us are and how we came to be a part of this really great collaboration and kind of this synergy that we now discovered that we all have in terms of the work that we conduct in our various institutions. And I hope all of you listening had the opportunity to listen to the presentation that Drs. Laurent and Conner gave on the YouTube channel for the center. It gives some really great information and background evidence about the work that they've done, and we're thankful that they kind of set that foundation for us for our discussion today. What we have on tap for you all are a few questions that we would like to pose to Drs. Laurent and Conner based on their presentation, and some thoughts that we had around, how our work parallels to each other. But if there are any questions from the audience, please feel free to type them into the chat, and we'll make sure that we weave those in throughout the remainder of our discussion, because you definitely don't want to hear us prattle on for an hour. So to kick things off, we thought we'd start with just a hopefully softball question. So Drs. Laurent and Conner, in your presentation, you made the connection between the 4 tenets of osteopathic practice and advancing community level health and well-being. And I love the connection that you made between those 4 tenets and the work that you do in the communities. And I saw so many parallels, and as a kind of framework for doing community-based health research and community-based work in general. And you provided a really great community example, but I thought we'd give an opportunity for you to talk about any other community work that you all are involved in, and how that work kind of mirrors those tenets of osteopathic practice that you mentioned in your presentation.
Sure. First of all, we're very, very grateful for the opportunity to join the center and to have this very thoughtful dialogue. We are very excited about this collaboration and this discussion as well. We're both excited for that. Yeah, as we had noted before in our presentation, what we hoped to have laid out was how the core tenets of osteopathic medicine around how, specifically for me as a family medicine physician, osteopathic family medicine physician, how I approach a patient in acknowledging that we have to look at the patient as a unit, mind, body, and spirit, and that the body has self-regulating mechanisms within itself. And that the other third mechanism is that structure of the body affects the function, and function affects structure of the body. And then the fourth principle being that we have to take all 3 of those things in consideration whenever I'm providing care to a patient. So keeping those things in mind, I found that, as I mentioned before in the presentation, that we're able to use those principles not only in the care that I provide for my patient, but also in the community as well. And so in some of the work that we've done in our community, quite frankly, has been to understand the interrelatedness of ourselves as individuals within our organ systems and our bodies and the way that it function, but also our interrelatedness between the community and how our community and the structure and the function of our community affects our bodies as well. And so we currently work along community entities through all multiple sectors to do one first thing. Number one, have them imagine what would it look like if you were to put a health lens in all that you do, no matter what sector you're part of in a community, whether it's education, the food system, whether it's in economic development or community development, housing, transportation. If you were to put a health lens or assess the health impact of every ordinance, policy, or rule around these sectors, how could it create a culture of health in your community? And that's the lens that we are inviting different sectors of the community to have a more different view of health. Typically, when people think about health and healthcare, they think of the 4 walls of a clinic. They think about a hospital, they think about an examination room. And in my experience as a physician, I immediately started to realize very early on that there were more forces and greater forces outside the examination room that was affecting the care of my patients. And so I had to engage and very much became intentional about creating that community and clinical linkage. And that's what led the launching and the establishment of the Delta Population Health Institute as the community engagement arm for the NYI CIT, College of Osteopathic Medicine at Arkansas State University. And when we became established, we had the distinguished pleasure of inviting Dr. Conner to come on board. And that we came together, we saw that we had an understanding of how our health was connected to our community. And so she'll talk to some of the core community examples that she has experienced of how these principles has been mirrored in her work that she's been doing in her work as a public health practitioner. Dr. Conner?
Yes, thank you, Dr. Laurent, and I echo, I appreciate the invitation today, and I am a Delta native, living 11 miles from Mississippi and 11 miles from Louisiana, so certainly very neighborly with both states. So as she mentioned, the structure and function of a community really can detail how they approach community health and wellness. And part of our community engagement strategy then is really to examine both very deep and very wide how those systems within that community are functioning. And so, the proverbial everyone is at the table, how do we approach that to make sure that we do in fact have everyone at the table, and we're using, data and personal stories and other information to drive the strategies that we're doing to improve health in its broadest terms. So there's been lots of communities really across the southern region of the U.S. who have, experienced outmigration, generational poverty, systemic racism, and other, natural disasters. Again, being right on the Mississippi River, we've experienced flooding in my hometown 3 of the last 4 years, and we are consistently seeing that being an issue. So community resiliency really has, a broad impact when you think about all of those things and how it really influences our health. So, whether it's, the establishment of a community garden or a farmer's market in a food desert, or looking at a commercial kitchen if there's lack of, healthy food retail, or, incentivizing like the Double Up Food Books program, to access fruits and vegetables. Or as we mentioned on a call yesterday I was on, we even have Veggies RX. It's a program where we have physicians that are prescribing veggies, and park programs where we're prescribing, walking programs at the near park. So it's taking those assets that communities already have and really looking at ways to be innovative and making those clinical community linkages, as we mentioned earlier, but also looking for economic development opportunities. So we have great walking trails, lots of lakes, beautiful attractions, and as we mentioned on this call earlier, thank you, Afton, great historical presence in our southern community. So how do we take that and make it both a tourism income generation opportunity, but also improve health by getting out and walking and making trails around those? So on the Arkansas side, we've been working with a major funder to create a 80-mile bike trail that connects, multiple of our rural Delta towns, and highlighting the cultural historical markers along the way, but it's also generating opportunities for pop-up restaurants, and hopefully those will have healthy food retail available, and for redevelopment of downtowns that have become vacant over time. And so I think that that's just a way that, as Dr. Laurent mentioned, the structure, function, and ability for communities to look how to self-regulate with the assets that they have is so important as we're thinking about the future of our rural areas.
Thank you so much for that. That's actually a really, really excellent segue into a follow-up that we wanted to ask about, knowing that both of you are healthcare providers and your background is in health. And Dr. Conner, I think you mentioned the socio-ecological model in your talk. How do you engage with others when you're having to address sort of non-healthcare parts of wellness? So, you mentioned economic, you mentioned education. How do you engage with others when you're trying to address broader health impacts, but maybe the core issue isn't a healthcare facility or healthcare as we traditionally think of it?
Well, that's actually a great question. And yes, as a public health practitioner, we often use the sociological model, realizing that, again, there are individual behaviors, but those individual behaviors are influenced by peers and social networks. And then that is all influenced by our organizational structures like schools and work sites and hospitals and clinics. And then that is actually impacted more broadly by policy. So all of those are interconnected, as Dr. Laurent mentioned earlier. You heard us say a lot, the interrelated ability to put all of those together. So quite frankly, one of the first things that we do is really show that model and show how all the pieces of the puzzle really fit together if you're talking about a culture of health. So I can just recall, I was working with a school district. We were trying to get a safe routes to school policy where, more kids could walk and bike to school. And deep into their manual was a no walking policy. And that was due to some highways and structures that were around the school. So it's kind of like you have to understand the policy barriers if you want to do the programmatic implementation, of which we know works. So, we were able to work with that school district, locate safe routes, make some adjustments, have a walking school bus program where it wasn't necessarily crossing the major highway, but looking at ways that we can increase physical activity. So, really, I think that's the key to my work, is really showing that broad perspective of how everything fits together, and then realizing that we are connected. So education must, kind of talk to economic development, because we know that schools and hospitals are very important when you're talking about recruitment of new businesses, right? And then we must have economic development if we're talking about a downtown redevelopment project. So I can share another example where we were working on a Main Street program, and I said, well, flowers are great, but what if we put edible landscaping? And so that was just a great example where it's like you can kill two birds with one stone, to speak, of saying, like, we can make it pretty and beautiful for the downtown area and increase access, to healthy fruits and vegetables, and encourage other growing behaviors as well. So I think that there's just opportunity and innovation. And when you start to think more holistically as a group and everyone sees their role in community health improvement, and that the bottom line is we all want healthy place and space. So when you start with that and you don't talk about a disease and you don't talk about diabetes or heart disease or cancer, and you just say, we want a quality place to live, then everyone has the same outcome and goal, and those conversations are a little easier, and everyone can start to see how everyone plays a role in this broader defined term of health. And I'll let Dr. Laurent add anything if she has something from the clinical perspective as well.
Well, actually, no, I think your examples were spot on. I would only add that currently, in light of the COVID-19 pandemic, we saw that it was easier to show this map to different sectors because health touched every single sector of our community. And so I think we have a better appreciation of it. We feel it a little bit differently. If we start with the topic of connectivity in rural areas, we know that if there's a lack of connectivity, you may not be able to get onto telemedicine. We know that during this time, people weren't able to go to their healthcare provider. They had to log on remotely, but if you didn't have connectivity, there was a health issue there. We think about small businesses that could not have customers come into their place anymore. They had to go online. If there was a lack of connectivity, okay, this affects small businesses. And education now is moving virtually. So we were seeing how all these things were interconnected, right? We had health and business and education were interconnected because of this pandemic. And so it actually is easier to show how these connections are real, and that the solutions really must approach it from that perspective. We cannot start with one solution in one sector. All these sectors must be considered when we think about how to resolve these issues and how to create a culture of health.
Thank you so much, both of you, for that great insight into that question. And I love this idea of starting from the same place. Everybody's interested in a safe and quality living space and living environment. And I feel like that works towards getting folks on the same page for how things might be improved, or where opportunities may be leveraged to improve those more specific clinical health outcomes. We actually have our first audience question, so we're gonna zip my question and turn it over to our audience. So the question, I'm just going to read it out loud, so forgive my poor reading out loud skills, but Dr. Laurent helpfully mentions the value of holistic thinking in advancing community and personal health. Where does local resistance to this perspective typically come from? And there's a few questions, so I'll go through all of them and then we can backtrack if we need to. So the first question again is, where does local resistance to this perspective typically come from? Okay. What kinds of strategies can communities use to bring more traditionally minded residents and professionals to the broader level of awareness? And Dr. Conner mentioned some great ideas, but are there others for how we work towards getting folks on that same page when we're coming at the issue maybe from multiple perspectives and not being able to see that the 40,000 foot view of the problem that we're looking at?
Yeah, I think that's a really good question. I find that when we talk about, and the interesting word in the question was resistance, I think the first thing is you have to be very intentional about defining the terms. There has to be an agreed definition of health. There has to be an agreed definition of a culture of health. And when people think of that word, there are a lot of things that people walk away with. One word that we use, and Dr. Conner had mentioned this, was quality of life. And you ask someone, what does it mean to have a quality of life? And you were to jot down 3 or 5 things, I'm pretty certain that those things would not be the same, but there is an overlap where you can create opportunities so people can achieve those goals. One of the things that we do when we work with communities is, number one community is just one community and there's none like it, okay? And so you have to take time to understand who these individuals are, what are their values, what's important to them, what gives them meaning, and from those we're collecting assets. These are the things that is already in this community to have resilience, these assets. You have to start with those points. And then have them identify where are the areas where are your pain points? Where do we agree upon are our pain points, right? And is everyone at the table? And what does everyone at the table mean and look like? So we do have to ask those very hard questions to make sure that everyone is counted in those discussions. So I find that a lot of the times when we're bringing and convening multiple stakeholders to the table to discuss these very complex issues, we have to define the terms. And that will be different for each community. And so if we're not on the same page about what the terms are, what we're agreeing our expectations are, and what we agree our benchmarks and success marks are, then we will continue to have this resistance as the word that the questioner was asking for. So that, I think I already speak to the strategies of it. I think, again, it's just defining the terms, identifying the assets, and making sure that everyone is heard, and making sure that people in the community are truly represented in the community. Those are the places, our starting points. I'll let Dr. Conner speak to that as well, that she's also provided technical assistance in that.
Yes, thank you, Dr. Laurent. And I'll just, again, echo what she said. In public health, community public health practitioner training, we have the tenets very much like the osteopathic tenets, where trust and transparency, and agenda setting are big points of our work and technical assistance. And working with communities through that, you have to identify the distrust and where it lies and why is it there. And it's like peeling an onion. You have to understand what that deep value is and where it, systemically came from. So if there's been distrust in the community, a lot of the times I found in my work that, we have to really address that distrust and look and examine that before we even get to obesity or chronic disease management or whatever programmatic implementation strategy we're trying to use. And the transparency piece, and this is something very, very important to the Delta Population Health Institute, is we're not here doing grant work. So we're not in and out in 5 years, or we don't have the goals of a particular grant. While funding is important, it's really that, as she mentioned earlier, that quality of life, place, and space. That is our goal. If there's funding opportunities along the way, that's great. but we don't want that to derail us. And so I think you see in a lot of community work that, you know, and funding is, I'm not saying it's not important, it's very important, but you have to make a strategy where if funding runs out, there's sustainability in what you're doing. And so, you know, whether that's through, you know, a tax base, if you're looking for hospital improvements to keep your rural hospital open, or whether that's, you know, an A&P, advertising and promotion tax for your tourism efforts that you just put in, you know, or whether that's, you know, teacher salary raises if you're really working on educational attainment. Whatever that is, there has to be sustainability built into that. And a lot of the work that we really do is looking at sustainability. So I'm going to go back to resistance, because change is hard. And I've heard more times in my career than not, well, we've already tried that and it doesn't work. Okay, well, let's examine what didn't work. And I'm a true believer in that there's policy windows. So maybe it wasn't the right leadership or the right, you know, time for city council to pass something, but maybe now something has changed. The pandemic has completely changed all of us. So, you know, that is going to present some opportunity. There was challenges, but it's also going to open up opportunity. So, you know, I'll share another strategy. I think that was one of the questions is, we do a lot of pop-ups, especially in rural communities. So we've done pop-up main streets, pop-up art galleries, you know, pop-up smoothie shops, because you don't want to implement something and spend your time and energy if it doesn't work. So there's always a trial and error, and there's pilot studies and pilot opportunities. And so I always encourage communities to look for the small wins. So what can we do within the next 30 days? What can we do within the next 90 days? And that momentum and that trust building really gets communities going and saying, okay, we accomplished this. Then you can look at those 1 year, 5 year, 10-year, you know, goals and implementations that you really need to do. So, so resistance will be there, but I think to her point, having a shared goal, building that trust, being transparent with why you're doing what you're doing, and looking at sustainability as a whole, I think that's what makes communities most successful in moving the needle.
Thank you. I think that was a really great response to that question, and actually leads really nicely into another question that I'll that we put together in anticipation of this. And you talked a little bit about this, the idea of shared goal making, of clarifying definitions of what's happening, and those kinds of things. And I think that both Dr. Cafer and I can have experiences with this idea around this idea of slippages or differences in how folks in academia talk about things that are going on in the community, and then how folks in the actual communities themselves have that same conversation. And so I wondered if you all could kind of talk us through a little bit about how we get to a common language in a little bit more practical terms, that so that we all know what we're talking about when we use a particular phrase or use a particular term in building that rapport and that relationship building process.
Yeah, and I can speak to that very quickly too. I know Dr. Conner certainly has some points to make to that, but one of the things I even apply with my patients, number one, is that you have to listen. And what I mean by that is when you have an academic institution that's engaging with the community, already there's an inherent imbalance in terms of the power imbalances. And so it is very important, number one, to be aware of these imbalances. And number two, most of your time is listening, 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 and listening. I would say release. If you're coming from an academic institution, release your agenda, let it go. Yes, do your homework, look at your data, but the data is just data because there's a narrative and a perspective to the data that will bring more insight to what you're about to approach. And so if that is not done in a thoughtful way, more damage can be done to the community, not only for that current relationship, but other relationships in the future with other entities. And so it's better not to start anything at all if it's not being thoughtful, I would say, because it really can hurt people. And this goes back to the trust issues that communities may have with academic institutions. And so it's really important that there is this intentional, what I call radical listening, and for a long period of time. The other thing too is going back to transparency, have community representation in those conversations. There should be no closed doors. Open the doors, bring them to the table, and speak openly, because at the end, whatever's being discussed is going to affect the community members anyway. So they have to be brought to the table, not at the time of planning, not even at the time of you're doing your homework and looking things up. Bring them into the conversation as you're looking at the data. Bring them into the conversation when you're doing preliminary work. Don't create a plan and say, hey, we're ready to go. Don't you think this is a great idea? Not a good way to go. You want to start, number one, learning, listening, learning, listening, learning, and listening. And I think if you do that in a thoughtful way and have representation of that community in these conversations, it can help eliminate many of the difficulties that some communities have when working with an academic institution. Dr. Conner?
Thank you. Yeah, I mean, academic and community partnerships can be a beautiful thing because you're bringing knowledge and expertise from the academic partnership. But then there's also a time on the community side that I always build in a time for reflection. I loved your idea of this sort of shared definition. I can remember working, again, in my bio said that I was instrumental in doing the Arkansas Coalition for Obesity Prevention. So you'll hear some people, policymakers mostly say complete streets, because that is the federal name of the program. You'll hear, you'll hear some practitioners say walkability. You'll hear some people say connectedness. And then you'll hear the community members say, I just want to go outside and be able to walk around, right? So all of those mean the exact same thing, and there's almost like a dictionary and a crosswalk, if you will, that we all mean the same thing. And one of the things that we do in our technical assistance is, okay, let's come to a shared, we'll call it connectivity, but we know that means complete streets. We'll call it this, but we're all using the same term, and I think that's important. But the reflection piece of it, so part of the technical assistance I do is holding 2 or 3 reflection workshops throughout that community engagement process, because sometimes we can get so busy doing that we don't stop and either celebrate or reflect or think about what worked and didn't work and why should we keep doing it this way. So I think reflection is a big part of what you're talking about in terms of being able to move a community forward as well in that academic partnership, because again, the academicians are researchers and we love to know, and that reflection can be part of that research process. It's great qualitative data that informs our, design process or our intervention process. So I think that is so important. And then Dr. Laurent mentioned the narrative. So there is data in narrative, and that should really be an iterative process that really build your next steps, right? So understanding the narrative and being able to build that in and have space on the academic side to shift and move as you're listening to that narrative. And lastly, I just want to mention capacity building. And I can remember if at a previous institution where we had community health workers, but this was in Texas, so they're promotoras, but we were actually teaching the promotoras how to do focus group analysis. So they were not only helping us recruit, but they were helping with the data analytic piece of it. And so that's capacity building, because you want for them to be able to do that if you're not available or you're not working in that community. Again, that's kind of the sustainability process. So it's also the skill sharing. And so teaching them how to design and what are you thinking through and how did you get there and how do you evaluate, right? And so some of that reflection is also showing the community how would you go through an evaluative process to know how to better the thing that you're doing the next time around. So I would just say, capacity building, reflection, thinking through that sustainability is all, part of how you can have a successful academic and community partnership.
Yeah, and I would also want to add, thank you so much, Dr. Conner. As you had mentioned the word sustainability, one of our aims is that as we're working with the community, when we are at the end of some type of a project, et cetera, we would like it to still be going on in the absence of our institution. Now, it just may be that the relationship may be different or the partnership may be different after that. But for us, sustainability has to be in the absence of this institution. Our partnerships, again, are important and they have value. We want it. Maybe it'll be redefined at the end of that. But if an institution's goal is saying, if we were no longer in existence, will this community be able to carry on in what we're doing? I think that's a really helpful question to have. And you'll just have different answers about that. But we like to keep that in mind when we're working with our community partners.
Thank you both. That was, I like the way that you're talking about that intentionality in that partnership. And we've talked a lot about how we as academics can support these sort of reciprocal, equal partnerships. I think a question that we sort of prepared in advance, given the mission of CREW, right, which is to empower communities to be the drivers of research. And I think this is something Meagen and I grapple with a lot, but you know, what, based on your experiences, would be good first steps for community members who are interested in this type of work, who have these questions about health in their community, but maybe don't know where to start? Because I imagine, or maybe I hope, that we have a number of community practitioners watching. So, you know, what would your suggestions be for first steps for community partners who want to engage in academics?
Yeah, that's a great question. And I would have to say the way that the Delta Population Health Institute was created was to address that. One, we know that this is, to some degree, there's some learning that has to be done. And in our technical assistance, we provide an academy, so to speak, to many of our sectors for them to learn about what does health in all policies mean and what does it mean to have a health sector. So there has to be this training. The other thing too is, what does it mean to invite a community member to be a PI on a grant or on a paper, right? So that we're all both contributing to this document or to this publication or to this grant. And so inviting them to that. So we do know that there needs to be education, not only on that side, but our side as well. We must also learn about what the needs are, what the assets are. And there are really great things already going, by the way. Like, we didn't come in with the solution. The solutions were already there. If it's a matter of us just creating a space and to ask different questions and to reframe questions so that we can have, so that your answers will always come out of the question that you're asking. And if we don't ask different questions, our solutions won't be different. And so what we would like to bring to the conversation as DPHI is, let's reframe the question. And then now, what does your solution look like given the assets that are here? So we're already acknowledging, going back to the osteopathic tenets, the mechanisms of healing are already there. You already have some level of resilience, and their capacity is there. What we hope that the partnership can bring is reframing the conversation about thinking about this thing, and then bringing that, again, some technical assistance in. If it's more understanding or knowledge about things that may not be known, then we would provide that. And also, we're learning as well, because we're being changed by these relationships. Our institution is morphing every time we engage with our community partners. So we look forward to how we are transformed as others are hopefully transformed in the way that we engage with one another too.
And I'll just add, I mean, some of the first steps that we take, as she mentioned, is just asset mapping. So, you know, sometimes we can live too close to things to realize the value or the asset of that. Or maybe it's been utilized in a specific way, but if you add an innovative approach to it, it's like, well, could we add this to it? And then it becomes multifunctional, especially with some of your downtown vacant space. So we do a lot of asset mapping. We do start with data, and not to overwhelm the community, but just saying, here's what the data says. But there also has to be the triangulation of data, because you know, perhaps the data was gathered through telephone survey, and there's not a lot of people who have telephone access, so it's not a representative of, you know, the community doesn't feel like the data is representative of what's going on. So you know, I mentioned earlier, I think the Robert Wood Johnson Community Foundation, Robert Wood Johnson Foundation, we use their community health rankings, and we just kind of dive into that and say, because that is looking at economics, it is looking at education, it is looking at a lot of the sectors that we often engage. So we start with the county health rankings, or we start with the local health department's data. But then I'll ask the Chamber of Commerce, hey, when was the last time that you did, a membership satisfaction survey? What are your local business owners thinking right now? Same thing with the school district. What's your parent engagement numbers? Why maybe there is a lack of parent engagement, or what's successful about your parent engagement? Bring that data to the table. So there's lots of, I'll reach out to the hospital CEO who are required to do, a community needs assessment, and saying, what are you finding, through that? I'll ask local clergy, what seems to be the issues among your parishioners. So when I say data, it's very robust, and that includes agricultural farmers. We have, especially in rural areas, we have farmers that are farming longer. We have generations that aren't necessarily coming back to the farm, which pose financial stress. We have increased suicide rates among, our producers. So there are, fundamental issues that are underreported, and you've got to have that open space for an assessment, and data can drive that. So I think to your question of, what are some of the first steps? It's really just having a town hall style, a town hall style meeting to say, what are some of the issues that you're facing? And here's what some of the data shows, and what are the gaps in between? And then moving to that process of shared agenda, transparency, building those trust, then the capacity building, and then you finally get to, the programmatic development or the innovative solutions. And like I said, sustainability is kind of along the way. It's great if you have a grand idea, but if we can't sustain it over time, what are some of the incremental steps that we can take to maybe get there, but let's not fail right out of the gate, because that doesn't help the hope of the community.
Thank you both for those really great responses and ideas for how communities can get started and how partnerships can be developed between academic institutions and the communities that they serve. And I think that this next question really has filtered through. Oh, I just saw a question from Martha Grace. So I'll zip it and we're going to read Martha's question. So she starts off by saying, thank you all for your time. This discussion has been really great. So thumbs up to our panelists. Where is the line, or is there a line, between the community and the researcher? Do you ever function as a researcher and a community member? And how does the overlap of those roles change your work? That's a great question. I'll zip it, turn it over to our panelists. Thank you.
Well, I would say that if you identify as a researcher in a community, embrace both of those ideas, both identities. I believe that a community member is also a researcher, and that a researcher is also a community member, and each identity has assets to serve one another. So I would not put a line there. And I think if I can understand the intent of the question is, there are things as researchers that we have to get done. Like there's this methodology, there are things that we have to have in place, right? And I think as a community member, your asset as a community member can bring the sensitivities of translating both, right? Where I find where we're interfacing, we're at a threshold, we can translate one versus the other. And that's a huge asset. If you're a researcher in your community, that's a sweet spot to be. And so you can translate when we have different languages, right? And I think number one is I would take care of my patients. My patients is number one. Not my medical agenda, whatever. The needs of my patients are number one. They're patients that I care for who may not prescribe to Western medicine, and I need to listen and understand what their values are and talk about where do we have some overlap and what are their goals are for us to say, well, what do you want to accomplish with what it's in my toolkit? And we have a very interesting conversation about that. And I would extrapolate that into the community setting as well, right? We have an idea about what's important for us. We have different values, and start with the community members, start with what their concerns are, what's important to them, what their values are, and acknowledge that that community member is a researcher too. They know what they're feeling. We're reading it on paper. They're feeling it, right? And so I think I don't see that as a binary question. I embrace both identities. That's an intersectionality, right? I think that's a wonderful place to be. It's a sweet spot. And I think the assets of each side can serve the other.
Well, as you heard in my bio, I actually did leave my hometown to be an RWJ community culture of health finalist. And so I have been a researcher in my hometown. So I did have to play the roles. And I would say if there is a line, it's curvy. So you're waxing and waning into each of the roles. And so there were very specific times that we were approached as a community because we were doing very innovative work. And they said, hey, would you like to partner with us? And I had to take my researcher hat off and say, is this what's best for our community? And so I shifted to a community member and said, you know what, this has the potential to be mission creep. This doesn't seem to fit. We could probably make it fit, but you know, is that's what's best for our overall sustainability plan, right? It is money coming in from a grant, but could it take us off mission? So I would say, you know, that as a researcher in my hometown, I waxed and waned. I think that there were times when there was an opportunity for me to be a researcher and again, educate the community on a very pressing issue. So I know Dr. Laurent knows this story, but there was an opportunity for us to go for a rural broadband, a rural broadband grant. And we had to do a lot of education, and I put my researcher hat on, even though I didn't have connectivity on my farm that's 7 miles out. I had to shift more back to that researcher role and say, hey, this is an opportunity for us as a community for a lot of different ways. And so I had to be more academic, I guess, that even though I really wanted it as a community member, because let's all face it, I wanted to stream Netflix on my farm, but I couldn't. But you know, my role there was more, it was more applicable for me, you know, and it was more beneficial for me to use my knowledge in a way that really pushed our community forward. So I would say from my perspective that if there is a line, it's very curvy. And I think it's just natural for you to know, even when I go into communities for which I don't live, and I've worked, like I said, up and down the Mississippi River, and into even places in Texas and Louisiana, I always put my community member hat on, even though I'm not a native. So if I were in that community member's role, what would it feel like when I walk into the door as an academic partner? And so you as Dr. Laurent mentioned, you don't really ever disidentify with that community member role, because you want that feeling when you come in, even if you're not native to that community. So so I'll just say that, you know, I always try to say, where's the local coffee shop? And let me go down there at 6 o'clock before my 7 o'clock meeting, or 8 o'clock before my 9 o'clock meeting, so I can get a sense of what a community member experiences, and bring that into a meeting where I have to be an authority as a technical provider or a researcher, or, you know, someone who's trying to lead the community, because you know, it's like the community buy-in, you know. People, if you feel authentic to them, they're more likely to listen to what you have to say. So I do a lot of ground sourcing before I walk into a community, to just say, where's the local art gallery? And can I understand the narrative through what the local artists are drawing? Where's the local coffee shop? You know, where is the whatever it is that is going to allow me to bring that characteristic in, even if I have to play my researcher role, so that the community can relate to what it is I have to say. And I always say, you know, I am a native of the Delta, because there's some connection there that we have that says, well, she may not be from here, but at least she understands some of the values that we have and share as a Delta region. So I'll just stop there and say, a curvy line.
Thank you both. I think those are really great responses. Martha Grace, if you need clarification or have a follow-up question, please don't hesitate to type that into the chat, and we'll make sure we get to it as quickly as we can. The next question that we had, and this is a topic that you have both been alluding to throughout the conversation that we've had so far. And so I'd like to hear a few more of your specific thoughts on managing expectations around timelines, because you both talked about this, like, this is a time-intensive process. It takes time to develop relationships, it takes time to implement programming, it takes time to collect the data, it just takes a lot of time. And I think that from both an academic perspective and a community perspective, the time it takes to do this well can be incredibly frustrating. And so I'd love to hear your all's thoughts on how do we manage that effectively, both for ourselves as academics, but then also from the perspective of our community partners, so that we can both kind of meet all needs as best as we can.
Yeah, and I know Dr. Conner certainly has some points to share about this. I'll just say that it goes back, number one, with your starting point is with the community. We may, and as an academic institutions, may have a lot of thoughts and ideas that we want to move forward and we think may be beneficial for a community, but really the person who's driving the conversation here are the community members that we're engaging with and walking side by side with. And then with that, identifying what the assets are, what the goals are, what the pain points are. And you just sometimes have to decide, maybe this is not the right opportunity. We're always a partner, but maybe this is just isn't, we have to let that go because we value relationship over us checking a box saying we've accomplished this. And then, you know, if there is something where there is overlap, where we can say, yeah, this is something that we both agree that is valuable to us, that there is an opportunity for us to share our assets to address this pain point. And then be realistic about the time, right? And not overpromise, under-promise, over-deliver, right? So just do that mostly because you want to build relationships and say, even if it doesn't work out, we're still a partner. I wasn't here for a paper. I wasn't here for grant money. I mean, that it really has to be a value of an institution to say, are you in it or you're not, right? So I'm in it because I really do care about the well-being of the people that are around me, because I know that also, not only that, it affects my well-being too. And so I think it starts with seeing where things are in sync from the very beginning and having to let go of things and saying, this is not going to work because it will jeopardize the relationship and may have a negative effect on the community at the end.
Yes, I agree. And I think I mentioned it earlier, but the small wins or the small celebrations or the reflection points, if you intentionally build those in, then you can, you can achieve things on a realistic timeline. It may not be the grand thing that, the community wants to do, but I also think the transparency piece of this is involving the community members in every step. So if they understand how laborious the task is and how many moving parts there are, I think that there is some grace in saying, oh yeah, and even if there is a missed deadline, they understand why. So again, I mentioned earlier, we get so busy doing that we forget to bring our community partners along the way. So just those weekly or monthly or bi-monthly check-ins that say, okay, this is what we accomplished this week. And so that allows them then to be part of that along the way. And they'll honestly self-adjust the timelines. They're like, oh, we're not going to make this. And I'm like, yes, you're right. Flooding, for instance, I mentioned that earlier. I mean, you can't plan for flooding. And so, having some space in there too, and not being so tight on your timeline that if you do have a pandemic or a flood or a tornado or some other, act that is like that you have zero control over, then you're not, that you've built that kind of in along the way. And again, those reflection points allow you to adjust the timeline accordingly, but it's a shared adjustment. And it's not a quote missed deadline because there's been some, talk along the way. And also, I think this is where I've also had an opportunity to go backwards to the funders and just say, this isn't potentially, if you're going to do authentic community engagement and that's one of your requirements, do you know how long this takes? And so it's also bringing your funders along the way. And I've seen at least 2 or 3, some state, one local foundation that have adjusted it when they see the authenticity of what you're doing and they see that it's incremental. And those are the opportunities for you to go in and do a phased grant. And you say, this is a 5-year grant and you want this at the year 1. How about we do a 2-year grant and I can promise this by year 1 and this by year 2. And then they see, oh, okay, I see the sustainability of this over time. And yeah, I see the capacity building that you've written in. I've seen the reflection that you've built in. So I think it's bilateral. It's both your funders, but also the community members, and then bringing them both in along the way and having those, as we say, crucial conversations that allows everybody to adjust their thinking process, their expectations, and quite frankly, hopefully improving either the grant making process or that academic community partnership process along the way.
So we have a couple of minutes left and one last question. Annie, do you want to go ahead and ask just with, really quick responses from our colleagues on the call? Because it's a good question. I feel like if there's students on board, they might want to know the answer to this one in particular.
Yes, yeah, and I've noted there are a few students on here, so I think they'll appreciate this, knowing a few of them do this sort of close intentional community work that you all have been talking about. What are the skills or experiences that you think students should be building if they want to do this type of work? Healthcare related or not, what are things they should be doing while they're getting their education that better prepare them for this?
So one thing that, well, this is a big, when you say this, there are many things to the this that we're addressing, but this is something that stands out to me. I think students and anyone, quite frankly, begin with community service. And what I ask all my students to do is, this community service that you're doing right now, how can you link this to a policy, system, and environment change? So it's not just a work that you're doing for the moment. So that you have to think a little bit more critically. Number one, this service that I'm providing, why is the problem here to begin with? Who's involved in that conversation? Is there a better way to solve this issue, right? And what policy, system, and environment issues do we need to address so that this community service is not needed anymore, ideally? Okay, so the starting point is just think about differently about the way that you serve your community. So anytime you go and try to build a house for someone, for Habitat for Humanities, or you're serving food at a food bank, think about the food system, not that you're packing food and sending out to someone. If you're thinking about tutoring someone in underserved communities, think about, well, why is this an issue? Think critically about the problem you're trying to serve and connect it to a policy, system, and environment change. Do your homework about the work that you're doing. And that's the advice that I would give to the students who are doing, starting with community service.
Yeah, and just in the few minutes that I have to add on here, I would just say exactly what Dr. Laurent said. And also as academicians, we can be very intentional about how we can put those small wins with student projects. And then the student project, it's very linkable to the next student, right? So it's not like an end date. It's like your piece of the puzzle is going to go into this bigger piece of the puzzle, which then goes into a bigger piece. So if they're writing a policy analysis, you're very intentional about saying, and here's the policy development strategy for which we're going for. We ultimately want a complete streets policy, but we got to get this one zoning thing right here, and you can do a policy analysis on zoning. So just being very intentional about how we lay out what the end goal of their project is, and how you're very intentional as a researcher of building where this student's research builds on the next student's project, which builds on the next one and the next one. And then those students then actually coalesce at the end and have that peer, like, we did this. So, it's not a start date and an end date. It's a piece of the puzzle that's really driving change at a very large level.
Great. Thank you so much. Those are great responses. And I think something that both our students can use, but, us as faculty who have students in our classes can use as well.
Yes, thank you. Thank you all. Thank you to our panelists and to our viewers for great questions. What great insight. We appreciate you very much. Radical listening, great takeaways, capacity building, sustainability, all important. We will make this available, so it'll be a great compliment. If you did not get to see Dr. Laurent and Dr. Conner's first video that is on the center's YouTube page, you will find this one, give me a day or so, but you'll find this one with that one, and you can watch them all there as resources. Okay, if you have any questions, feel free to email CSSC@olemiss.edu or me directly. I just thought that one was shorter to share with you. Thank you again, Annie and Megan. I'm going to use your first names, and Brooke and Jennifer for your time. You're welcome, your energy, and your thoughtful insight today.
Our
Yes,
pleasure.
thank you
It was
so
wonderful
much.
being
Yes.
with you. Thank you for this opportunity.
Thank you.
Thank you so much.
Thank you. Have a great day, everyone.